Hour of the Age Management Medical Group production brought to you by Boston BioLife. We are here with Dr. Mark Gordon of Millennium Health Group. Our crew is over there. You can tell they've been here a long day. You think it's winter here, right? They're bundled up. It's beautiful sunny South Florida and they're in winter coats. We've got Joe Krieger here from Boston BioLife and we're talking with Dr. Mark Gordon all the way from Bangkok. I'm kidding.
No. Los Angeles for today.
For Los Angeles for today, internal medicine, endocrinology, TBI. It sort of sums up everything we've done for the morning. We started our morning with TBI, we've talked to endocrinologists, we've talked to internal medicine doctors, and now we've got Dr. Gordon. Tell us about what you are doing here at the AMMG.
Well, I came to AMMG to give a 8-hour class on neuroendocrinology, which is the foundation for how we approach traumatic brain injury. Endocrinology approaches it at one level of hormone replenishment. Neuroendocrinology looks at the way that the cells in the brain produce hormones that regulate things like cognition or emotional status. So by assessing these hormones, these neurosteroids, we're able to either reverse or greatly improve people that have things like PTSD, TBI, depression, anxiety, bipolar, obsessive-compulsive illnesses.
Through different hormone replacements?
Correct. Because we're learning that hormones have multiple benefits in the system. We think of hormones like being sex hormones or
right.
reproductive hormones. Well, it turns out they're what we call pleiotropic. They have multiple benefits. Testosterone helps to remove Alzheimer's-related protein called beta amyloid. Estrogen does the same thing. Inflammation in the brain can be modulated by things like testosterone and estrogen. Pregnenolone will help with depression and anxiety. And this is what the science is that we're bringing to the forefront so that we can help our veterans, who I work with 100%, to improve so they can go back to a regular life without the multitude of medications that they're on.
So this is who we interviewed maybe in our last hour,
Yeah,
Carrie.
Took our class.
So he took your class and he was talking about it. And then on our first hour we had where her brother, the boxer, Ring of Brotherhood.
Yeah, they've asked me to be their doc.
So they've all,
consulting.
so they've all been on. We've had a full day here, Joe.
We've
talking about the protocols of everything that you were talking about and bringing this forward. So if someone's TBI or PTSD or veterans, these are all very different types of classifications that people are going through.
Right. They are classifications to try and make an appearance that they are uniquely different, but they're not.
That's
it
fascinating.
Doesn't matter not to denigrate the importance of our veterans, but someone who has a blast trauma or someone who has a civilian with an automobile accident or someone who has been assaulted or a boxer, like in this case here, the end result is that inflammation is generated in the brain, and that inflammation turns off a lot of the hormones in the brain. So you have all these variety of means by which this inflammation can be precipitated, and that's all those little cubbyhole areas. But the end effect is all the same. And what we address is the molecular level of the insults, which are inflammation, cytokines, the same thing that happens with COVID.
Cytokine storms, the inflammation.
So long COVID, we're able to reverse long COVID in 2 or 3 days.
With hormones?
With hormones or with addressing the inflammation. The bottom line is inflammation.
But how do you address the inflammation of the cytokine storm that the vaccine
Beautiful
was great,
question.
it did what it did. But there are certain levels of inflammation that people with autoimmune disease had
Correct.
inflammatory response.
Correct. So if you want to look at the autoimmune diseases like rheumatoid arthritis, Crohn's disease, or lupus, what happens is the inflammation in the tissue that leads to the orthopedic kind of pain generates these chemicals from our immune system called cytokines. And those cytokines go right into the brain. That's why you see 83% of the people with psoriatic arthritis also have depression. And when you treat the psoriatic arthritis with a medication called tumor necrosis factor alpha blocker, what happens is not only do the orthopedic problems improve, but also the psychiatric problems. And it's all due to the inflammation. With COVID and cytokine storm in the lungs creates an interesting pattern where the white blood cells accumulate in the lungs and they start dumping the cytokine storm. And those cytokines kill the lungs, and that's why people are dying. But in the brain, after trauma, the brain generates its own cytokines through cells called microglia, and that creates damage to the brain. So over time, it leads to things like psychological and cognitive impairment.
And how are you in some of these protocols? They're taking your coursework and then going to their provider, and you're training the providers to help them?
What we've trained over 1,000 providers. We have about 68 clinics throughout, independent clinics. All I do is I train them in the science, and we have a software package, which my background was in computer and electronics before I went into medicine, and spent the last 6 years writing a software package that takes all the information that I've accumulated relative to how to optimize interpretation of laboratory results. So we developed a biomarker panel, which has 28 markers in it, and the system analyzes them relative to gender, age, medical history, medication that they're on, and comes up with the best fit for that pattern of laboratory results, and tells you how to fix it, tells you what hormones to use, what anti-inflammatory products.
So it's not, what I love so much about this show, it's not one pill and then you have a side effect and you need another pill for depression, another one for anxiety, another one because you're tired, because you're sleeping all the time. This is all done through hormones and through individualized, everything we've talked about, but without the massive amounts of medication.
Correct. My partner is Green Gray, who was on his last tour of duty, his fourth tour. He was blown up, not a physical scratch on his body, but the blast wave created problems in his brain, inflammation, and he ended up on 13 medications, full-blown alcoholic and suicidal.
Right.
He came to us, we did his blood work, found out what was wrong, started him on the treatment protocol, ends up getting his MBA from Pepperdine, writing a book with his brother Adam that gets picked up by a 2-time Emmy Award-winning producer, made into a movie called Quiet Explosion, the documentary, Quiet Explosions. It's on Amazon, and it won in 2021 the Most Important Film of the Year award. Last year, it was given an Academy Award nomination. Unfortunately, it fell off the Academy Award on the shortlist. But it's about hope. It's about when you put people through our assessment and
Right.
treatment protocol, they get better. We've got over 3,500 patients.
It is all about hope. And what I also like, Joe, is how we're taking the science and everything we're learning on the research and the science and the medical side, and not only getting it now into the patients, but getting it into their families and giving everybody hope and a better life, a better quality of life, not just living and taking medication, but actually
Right.
having a functional, incredible quality of life to help others. Now this documentary is going to inspire others.
We're
You know.
hoping that it'll inspire more physicians to want to be trained in what we're doing. Joe and I, met over this situation. He's experiencing our products and the benefits from them, which is
Yeah,
Are they a different type of
I
product?
came here 1 year ago and I paid $500 to listen to his lecture, and then I found him on LinkedIn and we started communicating. Now we've become friends and we're collaborating in different ways. But tell them about your millennial product lines. I think that the brain rescue products are
Yeah.
fantastic,
Yeah.
and they represent kind of the next generation in the nutraceutical side. Remember we talked about drug delivery and
Absolutely.
bioavailability.
I do something called translational medicine. It is where you take the science and you apply it in a clinical setting, trying to find the optimal products for treatment. So over the past 16 years that I've been working this venue of traumatic brain injury, the literature directed me towards certain combinations of nutraceuticals. So developed 3 specific, unique nutraceutical products. Each one has 6 components to it, and then we started mixing them together, and we've done studies in 2020, 2021 with the Marines, put them on one product in the morning that they took for 90 days, and in 65% of the Marines who were on the product, they had a 50 to 100% improvement in their underlying conditions, which was based upon 20 issues: depression, anxiety, sense of well-being, exercise intolerance, poor sleep, insomnia, libido, and they had a 50 to 100% improvement in those 20 points, 65% of them.
And
so the products address inflammation, also the energy production in the brain through mitochondria and ATP. This is how we're able to give that clarity, and very clear, so you're able to go back to school. We have people
I
who
feel
are
like
now back
everybody needs this in some way or another, of something, because even
correct.
as we're biologically, chronologically aging,
Correct.
right, as we've all talked about, our mind has changed. There is depression, anxiety, inflation, people worrying about money and finances and children and parents, and there seems to be something of getting this into maybe not the same dosing, but maybe on a different side of it.
We have children who are using the product who have had been involved in automobile accidents, trauma from being hit on the head by accident or purposely.
What about basketball, football concussions?
Basketball, football, or hockey stick, or what have you. I have one where brother was teaching his sister how to swing a baseball bat, and when she came back, hit him on the head, knocked him out unconscious, fractured the skull, and he ended up having change in personality. And because of the age, we didn't go put him through the biological assessment with the hormones because of age. All we did was put him onto our product, Brain Rescue 3, and got better.
How are you doing on it, Joe?
I love the Brain Rescue products, and I think it's amazing that, Mark's one of these people that have been doing this well before it was popular, well before people even knew about it. He's been, an avid researcher and a clinician and helping, reaching out to help as many people as he can. And frankly, I think more people need to know about what he does, because there's not a lot of people in this field that understand the history of how we got here. People show up at the end and say, oh, you've got these problems, how do we treat it? And the way people look at treating it is with traditional drugs and surgery, right? But looking back at the homeostasis and the equilibrium part of it and how the body was essentially designed to perform, why did these traumatic brain injuries or these injuries of the mind stop those processes, and how do they change the patient, biochemically? That body of evidence is very complicated, and it's unique to each person. And you'll see, you see the patterns, and I can see it in your eyes when you say, oh, this guy had traumatic brain, oh, that's a veteran that had it. That person had this. And then you have the tools, we got the hormones, the peptides, and the gut health, there's a system here that when you apply it the right way, it'll work. But knowing how to do that, that's where he comes in.
It's all about hope, and that's what I found so much about this whole conference, is that there's hope. And just when you think there's not, and you think you're on so many medications, that if you go back to what God and science, whatever you believe in, gave you, we're back to skincare with organic products, toxin-free. We're talking about hormone therapies and things that you were born with. You talked a long time the other day about baby stool.
Baby poop.
That?
Yeah, doing the baby poop milkshake. So you're looking at the gut microbiome, right? And you want to look at how to restore normal biological function from, so people do fecal transplant, right? And they're looking at all this microbiota.
Imagine doing a baby
somebody
poop
talked about, well, there's a company in Boston that's purifying the bacterial part of the bacteria, and they're going public, and they're at what I call baby bio. So it's two scientists in a pickup truck that discovered a protein that cures a disease that can help very small patient population. Like Big Pharma only goes after 100,000 or more, right? And if you look at a pharma study at 1,000 patients, they're hoping that 500 get better, right? It's not going to make it. If you look to the people that got complete relief, very small percentage of those people, they reacted to a version of that drug. Now that drug's not going to see the light of day because it didn't treat enough people, but it made a difference to them. And just like any other industries, cell phones, computers, printing, all these things have gone to be these giant, mechanical issues down to something that's very individualized. And I think you're going to see that in laboratory sciences. I think you're going to see it in medicine. That's why personalized precision medicine, not just individual care, but unique to you. Like I can make something for you, but unless I know your metabolomics, your genomics, your proteomics, I don't know you. So I don't know how you're going to react to a certain thing, and not everybody reacts the same.
This is so specialized. And what you're doing by combining neurology and endocrinology to help veterans and to help TBI and to help people.
And he's keeping track of it and learning not only what works, but what doesn't work. That's teachable medicine.
Are your products available for people to purchase?
They're on our website, and it's the millenniumhealthstore.com. Okay. 60% of all proceeds go to help support our veterans programs. So we've been doing so well, we're now expanding out to include first responders, fire department,
Absolutely.
and law enforcement.
Check these out. I'm telling you, the information is fascinating. And to be able to give hope for you or your loved ones, Joe, the science here, all of these products, amazing.
That's why I wanted to be here and not in a booth. Because I have a much more effective platform communicating all of it than I am trying to, I provide a resource where people can come and learn, but really it'll take a month of Sundays for everyone to train everybody. And the science moves so quickly. So what people like I do and Mark do, we try to stay on the front line and we try to find effective ways. So my ability, what I have is an audience. I have a megaphone. I have the ability to, and I can propagate things that are self-beneficial, or I could propagate things that are beneficial to everyone. I prefer the latter because we all go together, right? We do God's will. And one of the things that got me into translational medicine is when a doctor said, if somebody tells you there's nothing that can be done, they just don't know enough.
They don't know enough.
Because literally every day, that's why we provide peer-reviewed research papers to anyone that wants to know. If 2 kids in India purified a protein and it's in a peer-reviewed journal article, you'll have it in your database as soon as you open it up. And it's unheard of. That information goes to academic researchers, medical schools, nursing, and big pharma. It's not available to, primary care physician in the small town. We want to make that so.
It's fascinating research. Check this out, millennialhealthstore.com.
MillenniumHealthStore.com.
These products are incredible. The science, the technology. Joe, thank you again. Dr. Mark Gordon.
As always, my friend,
We're going to take a quick break.
long road
Stay
together.
tuned, and we will be right back.